Hi, I'm Hannah, and I'm a nurse and a member of the Vicente COVID-19 committee. As you may know, we have been planning our response to a potential COVID-19 outbreak in a Vicente home since the beginning of the year. We have extensive plans in place that cover what may happen with residents at the home, as well as staff and a shared services response. You are a very important part of this plan. You have put your hand up to be part of the response in the event that we have an outbreak. None of us know where this may happen or when. It may involve only one staff member or only one resident who is sent to hospital. In any case, we expect that quite a number of staff will be sent home immediately for COVID testing, and that's where you come in. The key to prevention and response is to be well planned and to have people like you who want to go the extra mile for our residents and for the team. This briefing will cover some information from familiar faces on site that will help us understand what taking part in an outbreak might be like. We'll firstly very briefly recap COVID-19 before finding out about how to respond in a crisis and how to protect ourselves and our families. We want to explore how we could learn new things on the run in a Vicente home that we don't really know, and about communicating with the key people that we might see, including the media. We also want to ask, what are the financial implications of being in an outbreak team? What extra money might we get? Please ask any questions that you have through the email link at the end of the module. Lots of health services from hospitals and departments close to our homes have already got plans in place to help us if we were to have an outbreak. Their role is to come and support us in the care of our residents and our staff. Our staff have been very well trained in infection control and PPE. We have a large stockpile of PPE in place both in every home as well as up at the offices at shared services ready to send wherever it's needed. An outbreak will be declared when one resident or one staff member or one frequently attending visitor is confirmed as having COVID-19. Once an outbreak has been confirmed, things will happen very quickly. We expect it will be very busy, but very ordered as we've practiced. Everyone will know their role, what they need to do, and who they need to go to if they need help.
By now, we all know a lot about COVID-19, but just to recap, it is a very infectious respiratory virus that is mainly spread through droplets from one person to another. We know we can catch it if we pick up these droplets directly from a close person or where droplets have landed on a surface. Most people who get the virus only have mild to moderate symptoms and recover without special treatment. However, we know that it can spread very quickly in an aged care environment where large groups of people live together and can make some older people very unwell.
To keep it simple, there are 3 critical things to do in an outbreak to prevent the spread of COVID-19. Number 1, practice good hygiene and put on and take off PPE appropriately. Number 2, practice physical distancing. Number 3, stay away if even mildly unwell and get tested. These are the basic things we need to do both in preventing COVID-19 and managing it in a home. In the event of an outbreak, there will be people with us who have the role of reminding us and giving us some tips about our practice. Don't be worried, they will be there to help and support us.
Dr. Terry Nash, you're the Clinical Director of CarePact. Welcome to Vicente. Thank you so much for your time today. I have just a few questions to ask you. Firstly, during an outbreak, who would we expect to see at the home from external health services?
So the first thing that'll happen when there's a COVID positive result for an aged care resident in Queensland is that there's an immediate activation of the Emergency Operations Centre. So that's a part of the hospital-based response. And out of that is activated a public health unit commander, myself as the CarePact director, a infection control nurse, as well as an administration officer. So it's a core unit of 4 people that are part of our rapid response. We've set ourselves the target of making sure that we arrive at the scene of the residential aged care facility within 3 hours, so that we're able to coordinate with whoever's on site at that time and try and put in place all of the protective measures that we require for all of the remaining residents in that facility as quickly as possible. And so a lot of what we'd be doing is coming and asking you, how can we help? And also letting you know what resources we can activate should you need it. And so one of the big elements, I think, of the COVID response for our region is I think our aged care facilities need to know that the hospital and health service is going to do everything it can to support you. This is not something you do on your own, because I don't think that's possible. And I think that what you'll see from us is that we'll divide up the jobs. So the response in that situation about who to test, how to isolate, who goes to hospital and who doesn't, all of that is under the command of the Public Health Unit. And so they report directly to the Chief Health Officer, and I'm sure many of you have seen Dr. Jeanette Young on the news a lot, and doing a remarkable job trying to coordinate all of these different elements within the public health response. And we report directly to that element of Queensland Health. My role as the Care Pack Director will be to assist in the clinical decision making for your residents. And so some of the questions that I'll be asking is things like, who are the residents you're really worried about at the moment? Tell me about your dementia area and how you can go about isolating in that area. I'll be asking, can I talk to all of your GPs at the moment that look after these residents and let them know what our options are? And can we talk about the advanced care planning for residents? What I'll also be doing is making sure that not only do we have the standard PCR testing for coronavirus, but we also have an array of rapid tests that we can activate for select people. There's only a limited resource of that, but in coordination with the Infectious Diseases Unit, who I'm very close with, we'll be choosing residents that need a rapid test in order to help decide what is best for them. The other thing I'd probably stress is there is definitely no one-size-fits-all answer in this situation. Every aged care facility is different, and even within your group, each facility has its own needs and its own challenges. And so we want to customise the response for that particular facility. So that's how the conversation will go. And the whole way along, we'll be reporting to your outbreak management team commander. And so whoever you designate as the boss on site, we report to them.
Okay. Do you have any information around our north side home, Portofino? So how would that be different to the Metro South response?
No difference at all. So Dr. Denise Hobson is the equivalent for Care Pact on the north side, and the service called Radar. We have all of the same goals and we have all of the same objectives. The command structure and governance is the same. They still report to an emergency operations centre. And so I can guarantee you, Denise and I text each other quite a lot. We'll both know about it at the same time, and we'll be coordinating whatever we can. We're very aware that if at any stage we got to a point that Melbourne is just starting to come out of, that we would have a coordinated response across Brisbane. The divisions of the river that somehow create a sort of weirdness in Brisbane, we'll get rid of that pretty quick.
Okay. An outbreak sounds like it could be quite stressful. Do you have any tips on how we could manage feelings of stress or worry in a crisis?
I think the first way to deal with that is probably one of the things I've done in emergency medicine, is to first of all acknowledge it and acknowledge that everybody's going through the same thing. The manager that might look like they're keeping it together really well is probably just as stressed as you and just as stressed as the person who's shaking and feeling really, really stressed. We're all going through it together. The best thing we can do is understand what the plan is and understand what our role is. And so if each individual understands what tasks they can do and what they can't do, that can actually give you a bit of relief in that moment, because you can become just a little bit focused on what the tasks are you need to get done. But at the end of the day, I think it's about sharing the experience of how stressful that is with our colleagues who are all going through it, and understanding how we can call on the people that mean the most to us, and telling them that it's stressful. And I don't think anyone would expect us all to get through this without feeling stressed. And I think the key is we're all in this together.
How would we best support older people in times of stress and crisis?
I think that this is incredibly challenging for our residents, particularly if they have cognitive impairment. There's certainly, I've met a lot of older residents who are terrified that if they get it, they may well immediately pass away. The reality is most people survive this illness. Vast majorities do, even in the very severely frail. So I think reassure that this is something that we can get through. And I think that letting residents know that they're cared for, know that we're doing all this to try and limit the spread and keep them safe. And I think that making sure that whatever technological kit or services we have, from video to telephone, that we make sure our residents can stay in touch with their family as often as possible, because everybody's stressed, families at home will be stressed, and the resident themselves will be. And I think keeping those connections close is our best defence against the stress for our residents.
The biggest worry that many of us do have is taking the virus home and infecting our families and young children or older parents. How could we avoid it?
Well, I can tell you I've been on the emergency department COVID area of our 4 different emergency departments, and I've seen the infectious diseases unit in our hospitals, and staff in hospitals worry about the same thing. And the best defence we have there, I think, is understanding PPE and understanding that the most dangerous time with PPE in a COVID environment is the doffing of PPE. So I would say to you, if you're worried about your family, be absolutely pristine with your PPE. Be perfect with it. Treat it as it's very serious. It's not to be complacent with it. And a good friend of mine has come back from Melbourne, having worked in the aged care facilities that were COVID positive. And she would repeat that. She would say, be absolutely pristine with your PPE. When you're doffing, it's that stage that you want to make sure that you've cleaned every bit of you that's possibly touched that PPE. And that's before you leave the building. And that way you keep your family safe. And the other thing I'd say is many thousands of healthcare workers have looked after COVID positive residents and not brought it home. When they've done the PPE right, they've kept their family safe.
How could we reassure our families who may be worried about us going to work in a home where there's an outbreak?
Well, I think that at some level it's going to be hard to allay their fears, because we're in the middle of a global pandemic, and I think nobody is not thinking about it at the moment. I think that taking a big dose of compassion with that and sharing that fear a little bit, but explaining that you understand how to keep yourself safe and that it's important that you're doing this to keep residents safe. And I think that if we share that knowledge and compassion with our families, I think they'd understand.
Thank you very much for your time, Dr. Terry Nash.
It's a pleasure.
I'm here with Laura. Laura, you are a very experienced nurse and manager. For those of us who are used to being in only one Vicente home and knowing the building and residents really well, what tips could you give us about how to learn on the run?
Thanks, Hannah. That's a lovely thing to say. Our workforce in Vicente is very skilled and experienced, so learning on the run is something that I think they'd cope with really well. There are a couple of things that I'd look at. I'd break it down into transferable knowledge and non-transferable knowledge, which is quite site-specific. So things like policies and procedures, such as fire, safety aspects of the job, and how to complete things in line with good care, such as how to assist someone with a feed, how to use the hoist and make sure there are 2 people. They're all skills that people would know in their current workplace. So they'd just be bringing them across to a new environment. So the non-transferable skills, such as the layout of the building for a fire response, things like that you need to look at when you come to the building, and obviously the team would do a walkthrough and you'd be provided that information prior to coming anyway. So of the non-transferable skills, I could break them down into the environment. So you'd be briefed about where you'd be given a site map and briefed prior to coming or on the first day. And that would include things like where the common areas are if you required them, but in an outbreak situation, they may be used for a different need. Where the utility rooms are, so where your macerator is, where the clean linen's stored, where the unclean linen is stored. So all that information you would be provided prior to coming, but it's very important to know that first. The other information that you need before you come is, of course, first and foremost, residents. So you'd need to know residents' preferences, likes, dislikes, what their care requirements are. So the document or resource that I find extremely helpful in that situation is the care handover. So obviously you can filter that in eCase down into the wing or level in which you're working at the home, and you could print that out and keep that in your pocket and refer back to that as you need to during your shift. Once you're finished with it or you're going to another area, you could shred that because it gets updated regularly as a care need changes for the resident. So we need to ensure that we use current information. So in an outbreak situation, in each home there would be an area that's specified for the outbreak. So there'd be like a communications area, a donning and doffing area, an area for the Surge staff to use as a staff room. So that would be the place that would have resources. So those resources could be documents, policies in regards to that, on-site or site-specific procedures in regards to where things are, and also information from people. So it might be the clinical manager, the care coordinator, the facility manager might be there to greet you, tell you about what you are expecting that day, how the residents are that day, and anything intricate knowledge that you might need to know on the day.
Who should we ask if we need help?
Well, your first point of contact on the floor is your RN. So your RN or team leader, you'll meet at the start of each shift. They'll be giving you a brief verbal handover, and there's also the handover communication folder in each level or wing that you work on in one of the homes. So the RN is the first point of contact. If they're not available, well, obviously you could ask your co-workers, but if it's something more clinically specific, you could go up the line. So there'd be your care coordinator, your clinical manager, and your facility manager at each home.
In wrapping up this briefing, I'd finally like to reassure you that you will each get a full briefing at the home in the event that you're called to respond in an outbreak. This will include things about the home, site-specific procedures, who key staff are. It'll also include where to find specific resident information, such as a care summary displayed on the resident's door or a dietary list in the wing. We will take you through infection control and PPE once again and clearly tell you what you need to do and who will be there to help you. If you have any questions at all, please email the address on the following slide. Thank you for your time and your commitment.